as Uganda, as a country, the burden of cancer is still a big issue, and we're seeing rising cases of cancer in the country. But among all the different types of cancer known, there's one type of cancer called cancer of the cervix, which is currently leading in the country, followed by cancer of the breast. So when you look at in terms of the burden to guide focus on intervention, these two cancers I mentioned, they make about half of the cancer burden in the country. There are over 100 types of cancer, but these two alone is making 48.6%, which is almost half of the burden. But of all these, cancer of the cervix alone, each year in the country, we register 6,900 cases, making 33% of the number of new cases that we receive compared to all the different types of cancer that we have in the country. So this means that in terms of efforts, if you don't have adequate resources to fight all the different types of cancer, we need at least to prioritize cancer of the cervix and maybe followed by cancer of the breast. And both of these affecting our women. Cancer of the breast affects also men, but the chance is between 99% of the time it is affecting women. So today, we want to inform our media fraternity to let the people out there know that cancer is still a big problem, and cancer of the cervix still remains the leading problem in our country, that we need to really put our efforts together to fight it. And we have been doing enough as the Uganda Cancer Institute to make sure we increase the level of awareness about this type of cancer called cancer of the cervix. And the most important message for this type of cancer is that it is a preventable type of cancer. We know it is caused by a virus called human papilloma virus. This virus can be prevented through vaccination, and vaccines are available in all the health centers in the country. Then the second most important intervention against this type of cancer is screening. Currently, the government of Uganda, through the Uganda Cancer Institute, has been training health workers across the country. So that right from health center 3 and above, we're able to screen for this type of cancer. But more so, recently, we have been getting support from development partners. But the most important development partners currently we are working with is COFI, Korea Foundation for International Health Care. The representative is here. We're going to speak the detail more about the COFI project in Uganda. COFI, in the last 3 years, we have been working with them. They've given us a support worth $3 million, which is about 10 billion Uganda shillings, for 3 years to strengthen the capacity for government of Uganda through the Uganda Cancer Institute to manage cancer in the country. And in these capacity strengthening projects, we decided to start with the most common type of cancer, and that is cancer of the cervix, followed by cancer of the breast. And then later on, we shall extend it to cover other types of cancer. Being a pilot project where we want to learn from it and then expand this, the success we are generating from this project to the other parts of the country, we first pick 3 districts of Uganda: the Kampala Capital City Authority, and then Mbarara City and Mbarara districts. The Mbarara district is presenting the rural context of the health problems. So we feel after 3 years implementing this project in these 3 sites in the country, we are able to scale it, and the government of Uganda is able to maybe to see how to sustain this project with or without support of the development partners. And as I speak today, within Kampala alone, we have trained health workers in at least one of the main health centers in our division. For example, when you go in the central division, you are trained health workers in Chisenyi Health Center 4, you are trained health workers from Komamboga Health Center 3 in Kawempe, in Nakawa you are trained in Chiswa Health Center 3, and Mashinde you are trained in health workers from Chisugu, and Rubaga you have trained health workers from Shitebi Health Center 3, who are able to provide daily cervical and breast screening in those health centers. So we are calling upon our Ugandan population to take up those services, to know that really you can screen for the common type of cancer in the health centers nearest to you, especially when you're living in Kampala, in Mbarara, and in Mbarara City. But even other districts, we have done some level of training. But here in these 3 sites I'm mentioning, we have gone extra mile to mobilize, to really modernize the environment, to make sure there's no complaint that there's no screening equipment. There's no complaint that maybe the health workers are not well trained. There's no complaint that we are lacking reagent. They no complaint that we are lacking the register. We are trying to make sure everything is available in those facilities. And then we learn a lesson from that, look at the successes, and extend it to other parts of the country. So we feel that's a very important aspect for fighting cancer in our country by extending cancer services nearest to the people, where the people are, to reduce congestion, which we have been experiencing previously, where every person in any part of the country must come to Uganda Cancer Institute, which cannot be sustainable for the country. So I think and also maybe I need to add before I call the representative of our development partners, Kofi, we are also doing community engagement. You know, issue of fighting cancer itself is a complex disease. So you find that there's some small community issues. You may put everything there in the health facilities. All the equipment is there, the health workers are trained, but there's some small community issues that could be affecting people accessing these services. And you can understand that through effective community engagement. So we are conducting also community engagement in all these 3 districts. As I speak now, we have already earmarked sites for community engagement, which will start shortly from early this week and next week in a different part of the health centers within Kampala here, at Chiswa Health Center 3, at Chisugu, at Stebi, Chisenyi Health Center 4, and also Komamboga, where we shall be engaging with the local leadership in those areas, together with the health worker, to understand their problems, how we can even help them better to access these services. In case they're finding some issues with these services that we're currently providing, they should help us know so that we can make it better. Because we want them to learn, to use it as a learning step to make sure we scale it to the different parts of the country. Okay. And then maybe being asked to add some additional information about what is cervical cancer itself, first of all, and then the causes, the myths, and then how to prevent it. I'd already mentioned some of it, but what I can add is that when we talk of cervical cancer or cancer of the cervix, we are meaning a type of cancer whereby the abnormal cells, because cancer means abnormal cells that cannot be controlled. The body has tried its best but has failed to control. So when these abnormal cells start from the cervix, this is what we call it cancer of the cervix. But if this cell abnormality was start in another part of the body, we also name it based on that body part. It starts in the breast, cancer of the breast. In the prostate, cancer of the prostate. But what we're calling cancer of the cervix, we are meaning this uncontrolled cell growth, which the body has failed to put under control, and is spreading to affect other parts of the body. We are saying these cells have started from the from the cervix. That's what we're calling cancer of the cervix. The main cause known, almost by 99% known, is an infection with human papillomavirus, which I already mentioned earlier. And the human papillomavirus is transmitted through sexual intercourse. The cancer itself is not transmissible. The cancer itself is a non-communicable disease. You cannot spread it from one person to another. But there are some risk factors which can pass from one person to another. This risk factor is one called human papillomavirus, which you can pass it from one person to another. This human papillomavirus doesn't cause only cancer of the cervix. It can also cause other types of cancer, like penile cancer, cancer of the vulva, can cause cancer of the throat, can cause cancer of the head and neck. But the main one it is known to cause is currently cancer of the cervix. And then some of the myths regarding cancer of the cervix, there are so many types of myths. Many people, particularly among women, who are particularly women in polygamous relationships, some they think it is a witchcraft sent by their co-wife. So we're saying if really some people still there think so, that's not true. There's nothing like a witchcraft to do with cancer of the cervix. When you have cancer of the cervix, it means the real damage on your cervix, which was caused by a virus called human papillomavirus. And then other people think maybe some of the chemicals they use, maybe to clean their private parts, could be the cause. That's not yet true. The main known cause currently is human papillomavirus by 99%. And then we have also myth on vaccination, which not directly linked to cancer of the cervix, but fear of the vaccine. People think Why are you vaccinating our daughters who are 10 years old to prevent this cancer of the cervix? Maybe you have a different intention you're hiding. Family planning is that. That's the misconception which you're having currently. But that is not true, because we cannot hide. The Ministry of Health, the World Health Organization, cannot hide a vaccine under the name of, okay, maybe family planning under a vaccine. No. Because we have family planning methods, they are known and they are not hidden. They are clearly stated that this is IUD, maybe intrauterine device, this is an implant, maybe this is injectable or Depo-Provera, maybe this is a condom. They are well known that these are family planning methods. So they are not hidden under any other kind of vaccine or medication. So this vaccine is strictly for preventing cancer of the cervix. How to prevent? I already mentioned this. Let's make sure our daughters there, our sisters, your granddaughter there, who is 10 years old, get this vaccine from the nearby health centers. Previously, we were using only 2 doses, 6 months apart. Currently, now the Ministry of Health has even introduced a single shot. Your daughter can get a single shot to prevent this cancer. But the other preventive method, of course, this virus is transmitted through sexual intercourse, safe sexual practices. For our daughters who are not yet married, we are saying, don't engage in sexual activities till you are married. That is faithful, what we call abstinence. Then once in a marriage, you are saying be faithful with your partner. If all those things fail, but you are somebody sexually active, you are not a child, as defined as someone below 18 years, you're saying use condom to reduce the risk of getting this virus. Thank you so much for listening.